So for my part of this bipartisan package, I have House Bill 4629, and that's essentially the bill that really focuses on the staffing levels for those hospitals. A lot of folks, you've heard this testimony, but it's surprising to so many people when we talk to them and they realize there are no staffing levels that are set in law for our hospitals and related to how many patients can a nurse be assigned to care for at any one time. And this is particularly problematic because you've heard the testimony. Folks are being stretched too thin too many times. Now, we recognize that there is a clear link between the level of staffing and positive health outcomes or the prevention of negative health outcomes. Data suggests this over and over. When some recent polling was done that asked registered nurses about their experiences in hospitals. 86% of a poll of registered nurses in Michigan said that they are being assigned too many patients at one time. 86%. And beyond that, 22% report a story like Katie's, where they have witnessed a negative outcome where a patient died due to those staffing levels. 1 in 5 nurses have a story just like Katie's to tell. So that's why we want to do something. So this bill, really, my bill in this package has 3 significant components. The first is that it actually establishes those safe limits. And I would love the fact that we're talking about what exactly are the right limits based on science, because that will, no matter what they are, they're going to be an improvement over the 0 that we have right now. So that's step 1. And, you know, it's important here, I just want to be clear, because there are many hospitals that are doing fantastic work on this, and there are some that are not. And there is no amount of training that's going to replace, or education levels that are going to replace the fact that sometimes you just need more time and you need those hands to make sure someone doesn't fall, to make sure that extra set of eyeballs occurs, that they can check in on someone to make sure they're getting the care they need. That needs to be there, and that's why these caring ratios are so important. The second part of this bill, in 4629, is about making sure that nurses have a voice in patient care. So they're actually going to be, as part of the way that we set the levels, that 50% of the staffing committees that will actually include nurses. So they're going to be well represented in the way that we actually set those staffing levels in the hospitals. And finally, this simply requires hospitals to post information about the safe staffing law, right? Because if we were to move this forward, when we move this forward, we want to make sure that then all our patients and our caregivers know that these changes have been made. So at the end of the day, I really appreciate you taking time on this, because when we go to the hospital, we want to make sure that that ourselves or the people that we care about get the best care possible, and having safe staff ratios is a critical component to making sure that happens. Thank you, Mr. Chair.